Welcome to Shaping Healthcare, a podcast by CitiusTech. I'm your host, Laurel Rockel. Today, we are diving into a topic that is central to improving care quality and outcomes: care pathway adherence. In healthcare, clinical guidelines are meant to serve as a clear roadmap for treatment, but in practice, applying them consistently is far from straightforward. Each condition comes with evolving guidelines, multiple decision points, and diverse patient journeys, making real-time adherence a complex challenge. To explore this further, we are joined by two distinguished guests: Dr. Priyanka Lakhani, AVP at CitiusTech's Healthcare Consulting practice, who brings clinical expertise and leadership in care delivery and standardization. Kaushik Raha, VP of AI practice at CitiusTech, specializes in building responsible AI solutions that align cutting-edge innovation with healthcare industry needs. Together, we will explore the challenges of applying clinical guidelines in real-world care and hear perspectives on improving adherence across patient journeys. Dr. Priyanka and Kaushik, thank you so much for joining me today.
Thanks, Laurel. Great to talk to you again. Looking forward to this session.
Thanks, Laurel,
Looking
for
forward,
having me. Very excited today.
I'm looking forward to our conversation today. Thank you for joining me. Let's start with the basics, Dr. Priyanka. Why is care pathway adherence so important? And also, what makes it so difficult to achieve in everyday practice?
Right. That's a great question, Laurel. So, care pathway adherence, I would say, is the central pillar of evidence based medicine. So, as you know, medicine is guided by literature, by trials, by observing patients, and all of that data and insights are filtered down for all the doctors to use and available for even patients to read. And what is important is that doctors constantly update themselves with this information as new discoveries, as new findings come into play. But having said that, it's not just hard to kind of keep up with all that new information that keeps coming up. It's also hard to contextualize or personalize this information for each patient. And every patient is different, right? Be it age, race, ethnicity, demographics, lifestyle. Each and every of these metrics differ from patient to patient. So it's not just about reading literature, it's about applying those to each patient to ensure that that patient's specific needs are met. And that is why it's very hard not just to follow guidelines which keep changing every 6 months, 1 year, 2 years, but also constantly applying them to ensure that the patient gets the right treatment. And that's why it's very hard to do that in real life.
Yeah, everyone is different, and they have their own complex their diagnoses and all those changes, and absolutely, and also I would think there's a little bit of on the patient's end, the I know what to do, but staying on top of it is challenging too. So, can you both tell us what methods or systems clinicians can use to standardize care and translate these guidelines into real world decisions?
Right. I would say traditionally, these systems are called clinical decision support systems. Originally, they were books, flowcharts, literally small pieces of paper that could be stuck inside your ICUs and wards, just quick tidbits of information that providers can use on the go as every patient, comes their way. Now, as technology evolved, these became digital systems, the likes of Medscape or UpToDate, which were curated repositories of really good quality literature that was put up by doctors and for doctors. Then, of course, came a good old friend, Google Doctor, that everybody uses. But we all know there is a big trust problem with what Google, gives you. Now I would
Right.
say that with the evolvement of AI, you really have very advanced systems that's able to kind of not just read through all the literature but assimilate that into one place for a provider to kind of ingest and use. But it's not that easy. I would say, again, coming back to each patient requires their own interpretation of guidelines, and if you don't find the right information, you might be giving out the wrong treatment. So you do have to ensure that you're looking into those granular details and bringing out the best possible guidelines. Yeah, hand over to Kaushik.
Yeah, I mean, those are great points, Dr. Priyanka. I mean, I guess the one thing I would add is these guidelines. These are put out by national regulatory bodies and associations like the American Heart Association, or for oncology, for cancer, there's NCCN. Countries have their own guidelines, clinical guidelines, depending on the population that they serve. For example, NHS, which is based in the UK, they put out nice guidelines. So I think when it comes to like evidence-based medicine, it's very contextual and depends on what populations you're serving, what does your patient demographic look like, and as a result of that, they can also be very tailored, to that requirement. And in some cases, it can go down to the level of population or members or patient that you're serving, and there are guidelines specific to that. So, and these could be distilled from the best practices, but they are contextualized for the patient population. So yeah, these are some of the different methods or tools or ways in which these clinical guidelines are distributed and consumed. But one of the biggest challenges is really the dynamic nature of this. I mean, they change frequently, they're updated very frequently. And so it's extremely challenging for the physician to be on top of the ones that are already sort of prescribed. But we can leave aside the fact that even those are outdated very soon. So I think those are some of the big challenges that we have.
Yeah. And to follow up with that, as you're talking about the complexity of the care pathway adherence, across the ecosystem of healthcare tech, there's a lot of talk about AI transforming healthcare. We're looking at the complexity of care pathway adherence. How is AI really helping to make it more measurable and actionable in practice?
Yeah. So AI, like many other things, this AI also, is also now being leveraged for care pathway adherence, and one of the ways it's being able to make a mark here is because, again, the foundational models that we have, that are basically large language models, have the capacity to essentially understand guidelines, and then extract and synthesize recommendations from that. So obviously, this needs a lot of engineering in the back end, but you technically are able to automate the process of being on top of guidelines, or even sort of consulting guidelines, and applying them to the patient context, or the patient that you're treating at the point of care. And since this is an automated system, an AI system, there is less sort of burden on the physician or the provider to be doing that, to be doing that manually. Now the question is, how exactly it does it? That's where the AI magic comes in. It can actually take guidelines that are mostly written in long form, and it can sort of extract and distill the logic out of that, and then it can encode the logic that can be applied to the patient's situation, and all of this in a sort of algorithm driven manner, so that in an automated fashion you can essentially compute the adherence of the patient to the guidelines. So the physician does not have to sort of read the whole thing and understand and apply to the patient context, but they can the AI can assist them with doing all of that heavy lifting. The other way AI is also helping with adherence to care pathways is just keeping up with the sheer updates that are happening in this field. And medical literature is growing exponentially. So even to keep the evidence-based aspects of it updated regularly with literature search, review, synthesis, extraction. So even keeping it up to date is something that AI is starting to help with a lot, because almost like it's humanly impossible to keep up with literature and make sure that the evidence is being extracted and it's being synthesized and brought together in the form of a guideline, and manually. So I think that's the other aspect of this, where AI is really helping out. So
Yeah, absolutely. I could see just even that in and of itself being able to help physicians keep up with all of the the literature that's coming out, and as well as being able to, as you said, synthesize it, so they're getting the main points that they need and the actionable parts of it. We love a real world example. Can you maybe walk us through one where care pathway adherence made a measurable difference in outcomes or treatment?
Sure, I can take that. So, one place where we've worked in CT on this is care pathway adherence to heart failure management. So, maybe you would know that heart failure is one of the most common cardiac conditions there is. No matter what the actual pathology is, the physiological state of the patient is called heart failure. And it's also a very dynamic condition. So, you may be completely fine today, but let's say you go to one wedding party, you splurge, 5 days later, you're in very severe heart failure. You get the right treatment, and then another week later, you've rolled back to a less severe situation. Now, things like this are very hard to keep up with in day-to-day life, both for the patient as well as the provider. You can't expect the patient to keep coming and meeting you every 3 days. But the provider also knows that if I don't get that updates every few hours or a few days, I'm going to miss a critical window of opportunity. And this is where AI is truly path breaking. So it can automate the findings of the patient being symptoms, being vitals, just adapt them and map them to the right guidelines, and then keep the provider updated of the status of the patient. So to give an example of what these guidelines are for heart failure, these are the AHA guidelines, and they're called guideline-directed medical therapy, so GDMT. What it actually does is there are clear cut, I would say, hierarchy of symptoms of vitals. If these symptoms are present and if this is how bad the vitals are, this is the current stage or severity of heart failure. So it's not just going to help you with what treatment to give, it's also going to help you with how to stage and find out how critical is the patient. What red flags to look for to ensure that if the patient needs hospitalization, let's get them in. Or if they don't need hospitalization, let's keep them out. Why panic and why bring somebody into the ED? And then it will tell you, okay, these are the tests to order. This is what the value should be for it to be counted as normal. This is the medication that you start for a particular stage. And then you have to titrate those medicines up. So you go from an X dose to X to Y, X plus Y dose if the patient deteriorates. And it's very difficult to do this in real life. Most patients tend to move from provider to provider or ED to EDs, PCP to cardiologists. There's a lot of asynchronous treatment that goes on. What was the reason why a particular provider gave a line of care? At that point of time may not always be captured because of all the issues that exist in healthcare. Not everything may be documented. But AI can truly come in here. Not only can it map the patient's symptoms, hopefully in real time as technology, develops, but also keep this continuum of care. I would say the communication between all these stakeholders can become a lot more streamlined, and it can truly help with, I would say, triaging or risk management of a patient. And that is key to population health management. That is key to providing benefits to a large cohort of people as opposed to each and every patient. But when that patient does show up to see the provider, you can give a very good, targeted, focused, and precision care. That is the power of AI, how it can help with care pathway adherence and management. I would say risk stratification is incredibly hard. And what we've seen with our work we've done, it was very, very impressive that AI could do it.
Yeah.
Yes, very impressive indeed. Thank you for that example. Kaushik, did you have anything to
Yeah,
add to
I
that?
just wanted to just also, point out that Dr. Priyanka mentioned population health, and this is where the power of AI is sort of multiplicative, right? Because if you're automatically able to, measure adherence to these clinical guidelines or these care pathways, when you have patient data which is recorded in an electronic health record, then your population health view becomes more and more robust. What are the trends in your population or your patient population. Who is trending more towards heart failure stage. A to C, or B to C, or who is going from chronic kidney disease stage 1 to stage 2. So these big measures, these measures can now be automatically computed and tracked, and you can see the trends of your population in general, of the patient population. So from a population health point of view, it's really powerful. And this is something, it's almost like the holy grail of, you know, doing managing care for your patient cohort or your patient or members. For example, if it's an insurance company or it's a provider network, I mean, this is really what they aspire to do. And I think AI is starting to make inroads into bringing out that picture really well. So yeah.
Yes, thank you for adding that. Looking ahead now, what do you see as some of the biggest opportunities or challenges for scaling care pathway adherence across healthcare systems? Kaushik, I'd like to start with you.
Yeah. So I think one of the most important things is, again, I keep coming back to this, is the accuracy of these AI models or these AI systems. And if we are talking about large scale automation, which has impact on population health, we need to ensure that the adherence that is being computed or measured by these AI systems is being properly done. So if it's staging the patient based on patient data and contextualizing it with existing care pathway or existing guidelines, it's doing it correctly. So I think that's one of the biggest problems that we have to solve. And in our in our initial, experiments and work that we've done, we've shown that if the care pathways are very well structured and almost to the point that these are basically flow charts or clinical algorithms as we call them, where it is a lot easier there, or I wouldn't say easier, but it's a lot more tractable to make that into a computable object where the logic can be cleanly extracted and applied, and we can be confident of applying that in a way that is accurate and repeatable and measurable. However, when we are talking about like guidelines that are more complex, a lot more sort of open-ended, the care pathways, there are many complexities to the disease staging, and a lot goes into it. Then we start to see that validation becomes really important. So as we are thinking of scaling them, I think that's one of the biggest things that we have to do is to make sure that these automated systems, AI systems, are validated, and they are producing the right report. Because again, like here, you cannot have mistakes. If you're talking about applying them at the level of the population or even at the individual care, then you have to be sure that these are robust AI systems and AI models and AI agents that can do that. And I think this is on the optimistic side. A lot of this work is sort of agent-driven work, right? So I mean, it really falls in that bucket of agentic AI, and I think we are making huge strides in that area. So I'm very optimistic that as and when the agentic AI systems are becoming more and more sophisticated and more dependable and more reliable, it'll lead to scaling of adherence to care pathways with many benefits in terms of improving outcomes, improving population health. There's also clinical trials aspect to it, finding the right patients for the right clinical trials. So there are many aspects of clinical pathway adherence or care pathway adherence which will be realized because of as AI scales and becomes more and more robust and reliable. So I think that's that kind of direction that we aspire to go in the future. Yeah.
Yeah, that's excellent. And Dr. Priyanka, from your experience and your side of things, do you have anything to add there?
Right. I think Kaushik covered a lot. What I can add is the flip side to it. So, the good part is being able to give the right care to the right patient. Where you can also go in is to look for where the wrong treatment has been given to the patient. So, eventually, as the technology matures, you'll be able to find the edge cases, the fringe cases. So, like I said, not just where, let's say, the provider is giving the wrong care, but also where, despite giving the right care, the patient is not doing well. Now, this is something that's a very gray area today. There's really no way to find out. But it does happen in real life. You have patients who don't respond to these lines of care. Evidence based medicine, and it's a running, I would say, commentary in the healthcare circuit that medicine only applies to 99% of the people. So, how do we find who's the 1%? And again, that is a great finding using care pathway adherence, where AI ML can bring in pattern analysis. So rare cases, fringe cases, cases of allergies or improper medication, all of that can be kind of eventually extracted out from the same algorithm. And it's a very powerful tool, like I said. Once mature, there will be, I would say, a very, very exponential growth of how this can be applied to care delivery.
Very powerful indeed. Yeah, those are great examples and also opportunities as we look ahead. And as we wrap things up here, if you had to leave our listeners with one key takeaway about improving the care pathway adherence, what would that be, Dr. Priyanka?
Right. I would say, even though these guidelines are written for providers, with the advent of AI/ML, they are so easily consumable for patients and anybody else as well. Try and use them responsibly, not to, fault the providers or go in, asking why did you do this and why not. The idea is that this can give you a lot of good information. It can make your informed consent, your decision making a lot more powerful. Patients can have a true say in their treatment, and there is clear cut evidence that they can use. And that's a great starting point for people. I feel it's a very empowering technology, and it will democratize healthcare truly. So I would say just use it the best way you can so that you can get your treatment tailored to your needs as much as possible.
Thank you. And Kaushik?
Yeah, I mean, I think I would go back to my previous theme of using AI as a co-pilot, and this goes for everybody on the side of the physicians and on the side of the patients, to bring AI as a co-pilot or trusted partner into your workflows, and use the power of it. And I think that what that leads to is it also leads to improving these systems over time, which is extremely important for these to realize their promise. But I think what my suggestion or recommendation would be for all of us to be open to the idea of making AI your trusted partner or co-pilot, even in the care delivery and care management side of things. So yeah.
Yes, excellent takeaways. And thank you very much, Dr. Priyanka and Kaushik, for joining me today. Thank you for sharing your insights and bringing your expertise to our conversation today. It's clear that while adherence to clinical guidelines is a complex challenge, the combination of clinical frameworks and AI-powered solutions is really making some real progress. So thank you very much for joining me.
Thanks a lot. Thanks for
Absolutely.
having us.
Thank you so much.
Bye, Laura.
The Shaping Healthcare podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to the Shaping Healthcare podcast. Thank you for listening. If you want to share any feedback or would like to be featured in our podcast, do write to us at citiusvision@citiustech.com.